Hello, Dr. Brant Hulsebus here, and welcome to another edition of Ask the Chiropractor. Ask the Chiropractor is my little podcast that I do when someone has a question about chiropractic or chiropractic care. I try to answer. I'm a chiropractor here in Rockford, Illinois. I'm a proud graduate of Palmer College of Chiropractic, and I'm happy to be the team chiropractor of the Rockford Ice Hogs. Let's dive into it. Hi, welcome back to another episode of Ask the Chiropractor. Today I'm going to talk a little bit about a piece of research that came out. You know I love my research, and this one had a lot to do with the idea of walking. It's called The Effects of Manual Manipulation on Mechanical Gait Parameters. This is written from the Journal of Osteopathic Medicine by Y-A-N-U-C-K is a primary author, and this came out in May 30th, 2024. This is when I got into PubMed. So this is a newer article when I kind of try to keep reading, try to keep on top of stuff. And this one's really cool when it comes to chiropractic and when it comes to chiropractic neurology. And those of you that know me know I love talking about chiropractic neurology, and I love talking about chiropractic, and I love this neurology as a whole. So this one studied what happens when you lose your gait. What's your gait? That's how you walk, your walking stride. And there's been a lot of talk about walking stride and posture recently here, as we're talking in the summer of 2024, about the president and the way the president walks and carries himself, whether or not this can create some issues. And so this article talks a lot about the neurological things that you can notice when you have someone's gait. Let's talk about some of those neurological things. The very first thing that we have to take into account is the writing reflex. Left, right, the writing reflex. So we're talking about the writing reflex. If you've listened to my podcast, you know I talk about this all the time. But the writing reflex says at all costs, your eyes must stay level with the horizon. If your eyes are not level with the horizon, you'll have blurred vision, slurred speech, and lack of equilibrium. Basically, you look like you're drunk. And so your spinal muscles have a job to adapt and change your spine to keep your eyes level all the time. Matter of fact, these muscles are considered to be proprioceptive or balance muscles or stabilization muscles because that's their function. They're different than skeletal muscle. And the newest research is actually giving them their own category now of a new type of muscle. It's being called skeletal muscle versus stabilization muscle. And they're trying to say that you got to start treating these differently. This is why stuff like cortisone shots in your shoulder might give you relief, but cortisone shots in your spine are not indicated. The FDA did never approve those because it reacts different, maybe because the musculature is different. And you can't do the same thing you do for this kind of muscle, you do for that kind of muscle, and that's why they never approved it to have in your spine. Yeah, did you know that? You can't, cortisone shots in your neck and your lower back have never been FDA approved, and they're not recommended by the manufacturer. Now the shoulders, elbows, and different spots, that's a different story, but around the spine, it's always been contraindicated. Man, I love it when science gets in the way of doing things. All right, let's go back to that writing reflex. So your writing reflex is up here and your muscles coordinate. So if you're walking and your gait's altered, then your musculature has to adapt to that. And when it adapts to that, it has to keep your eyes level, and that might change the way your spine biomechanically moves, which can create stress on your spine, which can create a subluxation. Again, a subluxation is when one or two of your bones are misaligned, and the stress response kicks out, the fight and flight kicks out at that level, affecting not only those bones, but wherever those nerves go, whether it be an organ or a muscle or tissue. It affects all of the above. Right there, the writing reflex, huge thing. Posture, right? People with really bad walks, they usually have a goofy posture to go with it because, again, the same thing, they're trying to adapt to the inability to have a normal gait, a normal walk, and their posture starts to change. When you change your posture, you increase the stress load to your spine. Remember, we talked about the forward head posture. Every inch forward your head goes, it adds 10 pounds more gravity pulling down, which wears your muscles out, wears your joints out, wears your disc out. What does a chiropractor do? We adjust you, we teach you how to pull it back, we get the biomechanics working better, and therefore the body and the spine works better. Next thing, the mechanical action, just the actual receptors in those joints, they sense the way you walk. There's a reason we don't live in outer space. Gravity pulls on our spine and makes our spine do certain things, and we act to it for our neurological things. So if we live in a spot with no gravity, that all gets altered and changed. I personally don't think we can ever live on a planet where the gravity is different than ours, because of the way the body and stuff would have to change to adapt to it. When astronauts get home from long times in space, we don't see them for a while because they go through massive rehab to rebuild these areas. These are all very important things that our gait does and tells us about our posture and things. Now, long term, if you have a bad gait, let's say you were in an accident and you had to have your ankle fused, otherwise you lose your foot. So I would definitely say get your ankle fused. Let's say you've got a chronic bad knee and you walk funny because of your knee. Let's say your lower back sound affects your psoas muscle, PSOAS, your psoas muscle, that helps you lift your leg when you walk or go upstairs. If these things are misaligned, then what happens is every time you take a step, you're adding more torque and more force, and you're causing more issues on your back and your hips. And when you do these things, you wear out faster. The joints are under more stress, and they wear out faster. They get arthritis quicker, the discs go away quicker. There's just all kinds of negative things that happen here. So as a chiropractor, we find those spots that are adapting to the stress of you having an altered gait. So you have a bad gait, you walk funny, not funny, I shouldn't say that. You walk differently because of your previous trauma or injury. Therefore, you alter your gait, then you increase the stress on a certain vertebrae, and you can wear them out faster. My grandfather said, if you get those adjusted from time to time, we can keep the motion restored in there, and we can prevent the arthritis from happening. And I love the fact my grandpa said that, because in this practice, being 75 years old, I've got patients that started with my grandpa in their 20s, and now they're in their 90s, and they've been coming in like he said, and we x-ray them, and we don't find any arthritis in their spine. So if you know somebody just walking around with an altered gait, you got to remember that they're wearing their parts out faster. So working with a chiropractor, we can help hit reverse on that, and we can help alleviate the pressure on the spine. So even if your gait isn't from having a back problem, let's say there's two different ways chiropractors get involved in gait. First is you have a back problem that's making you walk different because of the back problem. We adjust the back problem, get the back doing better, the gait in return gets better. But if you've got a biomechanical issue, like I said, you've had pins put in your foot, you've had a knee replacement, maybe when you were 14 you tore your knee playing sports and they did surgery on it, it's not the same as the other side, so you walk a little different, you favor one side, or maybe it's your hip. Then you go to the chiropractor. What we do is we just keep hitting, like I joke, Control-Alt-Delete, and we hit reset on that area that's under the stress because of the altered gaits. So this research paper has basically said that people with an altered gait have got dramatic improvement and benefits by going to a chiropractor. And this is only for 5 visits. It only came in 5 times. They noticed a big difference in these people. And all those areas I talked about before, their posture, their riding reflex, all those things improve dramatically by getting chiropractic adjustments. I even have some patients that come in to tell me, hey, I noticed I'm starting to walk funny again. It's time for me to come in and get seen. I have a lot of patients, when I lay them down, they say, hey, which leg's longer, which leg's shorter, can you see it? And we adjust their hips, we adjust their lower back, and that balances off. They already know it's time for an adjustment because they've started to walk different. They've started to notice that, hey, when I'm walking, I feel like I'm kicking one leg further than the other leg. There's just so many different components. And remember, I've said it a billion times, if you want to do one thing to make yourself healthier and better, go for a 30-minute walk. Why? Because when we walk, we regenerate our spine. Now, if your gait's altered and you're not moving the right way, remember, the discs have no direct blood supply going to them in your spine. The only way they get nutrients is when you walk. The muscles of your spine, they contract, and when they contract, they push nutrients in and they pull toxins out. So if you want a healthy spine that's going to last you as long as you need it to last you, you got to keep flushing those joints out and adding nutrients to those joints. And the only way you can do that is by moving. And the best way to move, bar none, is going for a 30-minute walk, not on my feet for 30 minutes. Today, and I was working out this morning, I get up really early to work out, and we were all laughing because where we work out, there's a big Sam's Club parking lot behind us, right? And there was a driver for a big truck that was out there, and he was trying to get his steps in, but he wasn't going anywhere. He was just jumping his feet up and down, trying to mimic like he was walking to get his steps in. And there's a little benefit of that to get your heart rate up a little bit, but just going for a walk would have been so much beneficial and probably easier. But it's just amazing how people, they tell me, hey, I've been on my feet all day, I have X number of steps. I don't care. I want you to go for a 30-minute walk. Now, I'd rather you have 10,000 steps being on your feet all day than 10,000 minutes sitting on your rear end. Don't get me wrong, counting steps is great, but if you're not going for a walk, it's not the same thing. And if you can't walk right because your gait's altered, go to your chiropractor. We can either help you get your gait back, if it's coming from your spine, or if you have other injuries and previous traumas that's making you walk funny, we can hit reset to make sure you don't age your spine out faster than you're supposed to. I told a lot of my patients that someday when I finally pass on, I meet the big guy upstairs, I've had a couple questions for him. Number one question is, sciatic nerve comes out of the lower back, innervates your legs, it affects the way you walk and carry yourself. When you have an injury, you limp. When you limp, you add extra torque. The extra torque knocks your back out. When you knock your back out, you hit the nerve one on your leg, makes your leg longer time to heal. Why are we wired that way? I'm sure there's a reason, I just don't know it. And I also have had a podiatrist come see me. He said, hey, if I've had a patient that walks funny for a long time, they're probably gonna hurt their lower back, hurt the sciatic nerve. I said, exactly. And he said, if I'm trying to work on their feet and you adjust their lower back with the sciatic nerve working better, he looks at me and goes, you make me look like a better podiatrist by you fixing the back. I said, sure, whatever benefits the patient, however you want to word it, so the patient does well, we'll do it. So I've had other doctors, orthopedic doctors, podiatrists, work with me with people with chronic leg and hip that have affected their feet, that have affected the way they walk, knowing that if they get their lower back adjusted, they're going to heal faster and do better. So we have partnerships. Even the orthopedic friends of mine agree with me that if you have an altered gait, going to a chiropractor is important. PubMed has an article, the importance of it. If you want to read the article, I'm going to have links to my blog, and on my blog I have a link to the article. Take a look at it, check it out. Love for you to read it yourself and see what I'm talking about. Other than that, remember, like always, if you have a question about chiropractic or chiropractic care, there's only one person qualified to answer that, and that would be a chiropractor. So don't ask your medical doctor, don't ask your podiatrist, don't ask your dentist, because they don't study chiropractic. Just like I don't ask my optometrist questions about my teeth. That doesn't make any sense to me. All right, everybody, take care, have fun. If you have a question, leave it wherever you're seeing this, reading this, or listening to this, and the comment will come back to me, and maybe next week you'll be the question and ask the chiropractor. Thank you.